Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department for now again our weekly update. As you know, through the month of July, we were going every 2 weeks. We were here last week and now we're here again this week, which signifies some of the significance of what we're seeing with the Delta variant. The fact is the numbers have gone up over the last few weeks, the case numbers and the positivity rate. Fortunately for us, because so many folks have been vaccinated, well over 70% of our adult population, that it has mitigated the hospitalization and thankfully the fatality rate at this point. The concern is going forward where we will be and how much spread there will be. So Dr. Bogan is going to, as she gives her weekly update, update us on a lot of the information. And the one thing I can say is since the very beginning of this pandemic and from March of last year is things have always continued to change. So we need people to continue to just stay tuned to the data, to the recommendations that Dr. Bogan and our medical experts are giving to us. It's held us in good stead, but we still have some work to do to get these last number of folks vaccinated and protect the vulnerable in our population. So with that, let me turn it over to Dr. Bogan. Dr. Bogan?
Thank you, County Executive, and good afternoon. As the County Executive said, we are moving back to weekly briefings due to the rising cases. But for the time being, we are going to continue to report our county data using Allegheny Alerts on Monday, Wednesday, and Friday. According to the CDC, Allegheny County is now having substantial community transmission of COVID-19. We are having more than 100 confirmed plus probable cases of COVID per day now. The PCR positivity rate has climbed to 3.7% from 2.7% last week. As a reminder, the PCR positivity rate is the percentage of people who test positive for the virus using a PCR test out of all the people who were tested with a PCR test. Actual cases probably are a tip of the iceberg. We know that many cases are not detected. And that's because some people don't seek testing, and others have no symptoms and so don't know to get tested. According to the Pennsylvania COVID dashboard, hospitalizations in our county have also increased. And we know that most of those in the hospital are the unvaccinated. This late summer surge is due to the Delta variant of the virus. The CDC tracks variants across the country. In our region, they estimate that more than 2/3 of cases are the Delta variant. And as I've said before, we don't know an actual number of cases that are Delta versus another because most cases aren't typed for the variant, and there's quite a delay in when we get the information back. We do know that the Delta variant replicates and spreads quickly. Because people with the Delta variant have high viral loads in the respiratory system, when they sneeze, sing, cough, or just breathe out, they exhale a lot of virus that can then spread easily to others. Vaccinations continue to be the most important public health action that we can take to end the COVID-19 pandemic. Our goal is to prevent it from spreading further in an effort to keep our community safe. The importance of the vaccine for both the vaccinated and unvaccinated was demonstrated in a study of an outbreak in Massachusetts released by the CDC last week. The outbreak happened on Cape Cod in early July after numerous large and crowded indoor and outdoor events. Here are some facts about that outbreak. Of the 469 cases, 346 were among fully vaccinated people. Of those 346 vaccinated people, 274 experienced mild symptoms like cough, headache, sore throat, muscle pain, and fever. The Massachusetts Department of Health was able to conduct this study and track these cases due to cooperation with case investigations and contact tracing. This allowed the agency to implement mitigation strategies quickly. The department broadened testing recommendations, recommended the use of masks in indoor settings for all persons, deployed mobile testing and vaccination units, and educated visitors and residents on the virus and risk. Most importantly, with these mitigation strategies and vaccination, they were able to reduce the spread. Cases and percent positivity declined quickly, and outcomes were positive. There were no deaths and only 7 hospitalizations. The outbreak was effectively contained, and the community was kept safe. In the Massachusetts cluster, there was a high proportion of cases among the vaccinated, which really isn't surprising. As the population level vaccination coverage increases, vaccinated persons are likely to represent a larger proportion of COVID-19 cases. In Massachusetts, over 70% of people were fully vaccinated. And like in Massachusetts, we are also seeing an increasing number of cases among those vaccinated. And again, we expect to see more of those as the number of people vaccinated increase. As of today, nearly 68% of our county's population is fully vaccinated, according to the state's dashboard. Through case investigation, we have seen outbreaks and clusters from family gatherings, parties, weddings, travel events, and all other places where people gather without masks. Curative Inc. is still doing COVID testing for us in the county, and during registration, people being tested are asked about whether they've been vaccinated. Over the past 28 days, about 20% of those who tested positive were fully vaccinated. We don't have data yet for all cases, but we continue to work with the state on that. That is a lot of information, so let me boil it down to this. The Delta variant is very contagious and is driving the current wave of the pandemic across the United States. Locally, our cases are rising quickly, and we are starting to see increased hospitalizations. Even the fully vaccinated can get the virus, and because we don't yet know how having the virus will affect long-term health, it's best not to ever get infected if you can prevent it. Vaccine provides protection from illness that results in hospitalizations and deaths. So please, I ask you again, go get vaccinated. For the health department to be able to respond to cases and limit the spread in our community and keep us all safe, we need your help. If you're sick, have symptoms, or were in close contact with someone who is a positive case, please get tested. If you test positive, please answer the phone when the health department calls and provide information so that we can prevent further spread. Follow the CDC guidance. Their recommendations are based on the most current data and information available. As I indicated last week, I support the CDC's recommendation, including those for children in preschool and K-12 schools. As a pediatrician and a parent, I don't want children to get this virus, even if the infection is mild. We don't know the long-term effects of the virus on health and development, and children can spread the virus to others. Finally, I always end these briefings with the words, be safe and be kind. These aren't just words. Passions are high. For every email or call I've received advocating one position, there is another advocating the exact opposite. The last 17 months have been stressful and challenging. Our emotions are erupting, and that's natural, but we shouldn't be taking it out on others. Being kind is something that we are known for here. We are, after all, part of Mr. Rogers' neighborhood. So I ask you, be safe and take care of your whole selves, physically and mentally, during this time. We want you to be informed, but take breaks from the news about the pandemic and disconnect once in a while. Take deep breaths, stretch or meditate, try to eat healthy, well-balanced meals, exercise regularly, get plenty of sleep, and make time to unwind. Connect with others and connect with your community. And with that, I ask you, please be safe and be kind.
The first series of questions that we have are from the Post-Gazette and are related to the flu season and COVID. Are we anticipating a more aggressive flu season with a return to school, work, and changes in masking requirements?
I cannot tell you what the flu season will bring, but I can tell you what you can do to minimize it. We know from last year that wearing masks really does prevent the spread of all respiratory infections. So you can wear masks during cold and flu season. And we know that vaccines are very effective. So I encourage everyone to start planning for their flu shots, which will become available in the next couple of weeks.
How will vaccinations for both the flu and the coronavirus roll out?
Well, we have lots of COVID vaccine available at many, many locations across the county. So if you're having any issues, you can call 211 and they'll help you identify a location to get a vaccine. You can use our website, but COVID vaccines are widely available. Flu vaccine should be available again starting in late August or early September. And I know that the health department is planning many events, but so are all the places that always provide flu vaccine, all the pharmacies, all the healthcare providers. So again, I hope that there'll be a big push to give flu vaccine again this year like there was last year.
This next question is from both the Post-Gazette and WESA. I've combined a number of questions together.
All right.
Are mask mandates and other mitigation measures being considered by the county? And if not, at what point may they be considered?
Well, they're not being considered necessarily at this time, but what I can say is that the health department and Dr. Bogan and her team are continuing to look at data and continuing to look at what's happening on the ground. At this point, we're recommending to follow the CDC guidelines, which makes the various recommendations when it comes to masking and other things, and we're strongly recommending that people consider those recommendations of the CDC. But to say, what would change, it's just hard to say. There's so many different factors that can affect that. The good news for us right now is, again, so many people have followed the recommendations of our medical professionals and become vaccinated. And more people are doing so every day. So that is really the key to the entire pandemic, as we've learned, and that the data gets stronger and stronger, literally on a daily basis, the effectiveness of the vaccine. So again, there's no way of knowing what next week or the week after or the month after that will entail. It'll really be based on the data.
This next question is from WESA. In today's release, the county reported 268 new coronavirus cases over the past 48 hours. Do you know how many of these people were vaccinated versus unvaccinated from that report, or about the cases reported over the past week?
I do not have that data. I know the state is trying to work on that, and as I said in my remarks, we have limited data from the work we do with our curative testing, but I don't have additional data than that.
And this final question from the Post-Gazette. Can you talk about how the county uses the municipality level information on its COVID dashboard to inform its vaccination strategy?
So what's on our dashboard is actually cases, not vaccinations. The only data we have about vaccines is based on zip code. And again, we're still working on those data. And what we're trying to do is target and put events and make sure that there's vaccine available in all of our communities, which there really is. We have very wide distribution of vaccine in our community. And so we're looking at vaccination rates currently by zip code. But again, the data are still being cleaned and really not ready for public sharing at this point. So as soon as we have good data, we will share that. But we don't we don't have enough cases. Well, I think that answers the question well enough. Yeah.
And that was the final question. If there are any closing remarks.
Thank you, Dr. Bogan. And our next briefing will be next Wednesday. And again, what I think Dr. Bogan and the medical experts have been telling us since the very beginning is things will change. And the Delta variant is just one of those mutations of the virus that was almost anticipated in some regard. And that may happen again. There may be other variants that occur. So, but we do know the effectiveness of the vaccine is not disputable. It really has been this saving grace for so many people that you're 99 point whatever percent effective when it comes to dealing with the severity and fatalities and those type of things. It's almost like these dangers are going to come, and I know I've used this analogy before, but when you're driving with your kids, what do? You want to protect them. You put on seat belts. Well, when you come into more dangerous driving conditions, like a variant or snow, rain, or whatever, you make sure of that seatbelt. The seatbelt can give you that protection, and that's really what the vaccine corresponds to. So as these changes and variant and things happen, it's really been the vaccine that has really kept us much, much safer over the last couple of months, certainly than we were 6 months ago. So anyway, to follow Dr. Bogan's words, be kind, be safe, and be kind. I hope I said that right. She says it so much better than I. But anyway, let's get everybody vaccinated. Let's get protected, and all be safe. Thank you.